Thanks for listening to the Wild Health Podcast. For the foreseeable future, you're not going to hear our normal intro or outro here. We're going to be releasing episodes very frequently as things are changing. This channel will be used for a very specific purpose. Number one, to communicate with our patients. We're somewhat overwhelmed, and the more we can communicate breaking news and recommendations from us to our patients all at once, the better. So if you're a patient, we're here for you if you need us, but if possible, please tune in here so we can both keep you up to date and conserve our time for the most critical tasks. Feel free to share this with friends and colleagues as well. Number two, we've organized as a group. We have infectious disease specialists, ER doctors, critical care doctors, and in total dozens of MDs, PhDs, and frontline clinicians who are going to be constantly evaluating the news and emerging evidence. We're then going to summarize and translate that for you here every day on the podcast. The speed of change with the circumstances will make us look foolish at times, but we're committed to pouring all of our resources and energy into doing what we can to help and make a difference. You can also follow our updates at wildhealth.com or our Instagram account at wildhealthmd. And if you're a patient, we're here for you. Please tune in here for the updates and let us know how we can help. Dr. Akpunonu, thanks so much. I know you're working an ER shift today. I'm actually on one now as well, but we had a few minutes and I had to pick your brain about this. For those of you who don't know, Peter's a close friend of mine. He's also emergency medicine board certified, as well as toxicology fellowship trained from OHSU. He's my go-to expert, everything toxicology related. And for those of us who are working in the ER, we're constantly thinking about how to not get this crazy virus with all the exposures we're getting. And you sent me a really cool study and link the other day. You've been really digging in intensely on what we can do because there's just a dearth of information. It's so new. And there was a couple just really cheap over-the-counter things that anybody has access to. And just to preface this, there are no FDA-approved treatments for COVID-19. There is nothing that is going to guarantee you don't get this. But you're as smart as they come, and this is something you said you're doing, so I wanted to just hear why. And it basically comes down to vitamin A and melatonin. Really cool study that you sent me, I think, out of Cleveland Clinic. Can you just talk about this study and your interpretation of it?
Yeah, so what they did was actually super cool. So they basically went through and kind of analyzed everything that we knew about old coronavirus data. And the old coronavirus is based off of protein and whatnot. They then went and compared the DNA and the RNA that each one of them had and found that our current COVID exposure, our COVID that we have now, is most closely related to the original SARS that we saw a few years ago. And then based off of that, they kind of took our, let's not say, some of our older medications and some medications that may have multiple uses, and they tracked them back through the literature to look at the targets that they had, both targets for humans as well as for the coronavirus. And what they did was they zeroed in on what we thought was, ACE2 has been getting a lot of play as potentially being used for viral entry into human cells. So focused in on ACE2 and looked to see what other proteins exist in this kind of body, in this interactosome that they, as they called it, between the virus and human proteins, as a potential means of targeting and preventing entry of the virus into the cells. And so what they did was took a bunch of computational data and then added multiple drugs together to see where would they be interacting, how would this, in theory, affect proteins and affect the virus's ability to enter into cells and cause an infection. And most of what they looked at were anti-inflammatory medications, as well as some cancer medications, as well as a few antivirals, all of which require prescriptions. But when you look through and dig through the data, they get a decent hotspot for both vitamin A and for melatonin as being potential means by which you can prevent viral entry into your cells and potentially prevent you from getting your illness. So, based off of what I could see from there, vitamin A, although itself can be toxic in large excess doses, in low doses, this may be a means of preventing us from getting ill. I would still say that my standard recommendation is take your vitamins, keep exercising, get your immunity built up. But, the addition of another 1,400 international units of vitamin A a day, plus a couple melatonin at night, may, one, help to improve your sleep. We know that sleep is very important for immunity, but it may also provide you an extra layer of prevention of coronavirus entry into the cells. Again, this is just a computational study and have no randomized control in vitro or even in vivo studies to say that this is going to be 100% effective by any stretch of the imagination. But there's relatively low toxicity when taken in these doses, and I think it's a worthwhile endeavor to see if you can't prevent yourself from getting ill. Especially as an emergency physician, I don't want to get sick. If I get sick, I can't treat the patients that I need to treat, and someone else has to come and cover my shift. And that's going to be the real issue that we're going to be facing down the road here, is just having enough bodies to treat the ill that we have.
Yeah, so, and just to be clear for everybody, so if you want to look this up, it's called Network-Based Drug Repurposing for Novel Coronavirus 2019. This is in Cell Discovery. It's a really old article. It was published way back on March 16th, 2020, which the pace of discovery, we're thinking about things now, a week old. But this is brand new, and just like Peter was saying, just to reiterate, these drugs have not been studied in humans. This is not a study saying, does this work to prevent the coronavirus? It is just kind of something leading to more studies potentially, but it's not an answer to prevent it. But the thing I liked about it, I think why you're positive, what are the downsides and risks of vitamin A and melatonin? They're pretty safe and well tolerated by a large number of people already, right, Peter?
Yeah, so melatonin, not a whole lot of toxicity to worry about. Vitamin A, when you start getting into very, very large doses, you're talking over 12,000 international units and up, you can start getting into legitimate problems. But I wouldn't get anywhere near that. Me personally, I'm just taking an additional 1,400 international units of vitamin A.
Yeah, and you're the board certified toxicologist. You're the expert on this, so it's important to talk about that, because the other day when the president started tweeting and talking about chloroquine, we had people overdosing in some countries on it and getting some toxicity. So we don't want something like that. So don't take your bottle of vitamin A. This is not, don't go eat the polar bear liver, large amounts of vitamin A. This is like you're talking about 1 or 2 capsules that you would normally be supplementing with, right?
Exactly. Yeah, unfortunately, we've got our first hydroxychloroquine and chloroquine deaths in the United States that just occurred overnight from people taking excess amounts of the medication. Really, again, it would just be, take a capsule, 2 capsules. If you're not already taking it, take 1. And, hopefully, based off of what is, computational data, you can maybe prevent yourself from getting ill.
And the melatonin, the dose, you said you were thinking about kind of 5 milligrams. That's much bigger than a physiologic dose, but it's still not a dose that would be worrisome in any manner, right?
No, that is not a dose that I would expect any toxicity out of.
Great. And any other thoughts on it? I know you're busy. I don't want to take too much of your time, but anything else you want to say about those supplements or any others?
No, I think what you have to do at this point is make sure that you're taking excellent care of yourself. That's continued with exercise. It's continued with getting the appropriate amount of sleep, making sure that you're staying hydrated, make sure that you're getting good nutritional supplementation in there as well. Make sure that you're getting your vitamins and everything else. It's easy when you're sitting at home, essentially not doing anything, to reach over and grab that bag of chips and just keep eating, another bag of chips and another bag of chips. What you really want to make sure, especially at this point in time, is that you're getting a balanced diet, that you're getting the vitamins and nutrients and the micronutrients that you really need in your diet. And that's what's going to keep you from getting sick. That's what's going to help make this disease more manageable for you.
Well, Peter, I think I would be remiss if I didn't ask you, at least while I've got you on, I kind of put you on the spot about hydroxychloroquine. Do you have any kind of warnings or thoughts about that, being a toxicologist and probably having more experience than most physicians with the medication?
I do. So the relative safety of chloroquine and hydroxychloroquine is it's not particularly good. These are medications that we find on the 1 pill can kill list for children, where a 250 milligram ingestion for a child in a toddler age child may be enough to cause them to die. Typically, what people die from are related to cardiac arrhythmias. So with the current recommendations I'm a little bit concerned with the current recommendations of using hydroxychloroquine plus azithromycin. These are 2 medications that can cause arrhythmia. And some of the primary care doctors that I've spoken to, because of the concern about the angiotensin converting enzyme receptor, they've actually been switching people off of their ACE inhibitors and putting them on calcium channel blockers. And so, that potential combination of calcium channel blocker plus hydroxychloroquine or chloroquine plus azithromycin is a real big setup for people to have malignant dysrhythmias and potentially die. If I would stick with, what I've been able to read is we can use hydroxychloroquine and chloroquine in those patients with severe disease, severe condition, and that's where we've seen the most benefit. I haven't seen any evidence to suggest that prophylaxis is the way to go. And admittedly, starting people on prophylaxis and prescribing prophylaxis is going to do a lot more harm, one, by exposing them to more toxic doses and more toxic substance, but two, you're also going to harm some of our patients with chronic rheumatologic conditions that are already on this as the drug becomes scarcer and scarcer and are not able to receive it.
Yeah, and we may in the future find that maybe for people like you on the front lines, maybe there is a prophylactic dose that does make sense, but we just don't have that data there. There's definitely no reason for someone in the community who should just be isolating to be taking this medication. More risks than benefits, in my opinion, as well. Yeah. And no one is even, and it's crazy how you had to say, even though there are some recommendations, no one is really recommending this. It's just out there so much. So I would encourage people to really, when you're watching the news, listen to the scientist at the podium, not just anyone, and we're not going to get political here, but listen to the scientists, follow the CDC guidelines, and don't be playing doctor at home on yourself in these dangerous and scary times.
Exactly.
Well, thanks so much, Peter. I'll let you get back to work. Stay safe. It's good seeing you.
Anytime. Take care, buddy.
Thanks.
Thanks so much for listening to this COVID-19 update. Please send us your questions or follow along on Instagram and Facebook at WildHealthMD. And just to be clear, this is not medical advice. No patient-physician relationship has been established, and this resource is really for general informational purposes only. And finally, if you want to spread the word, please send this podcast to friends and family and give us a review on iTunes. Thanks again, and stay safe.